Drugs, medication, chemicals. Synonyms to each other, but are they all the same? To understand that, we need to ask ourselves this question. What is a drug? When you hear the word drug, what's the first thing that comes to your mind? Treatment? Addiction? Bitterness? Crime? All of those are reasonable conclusions to the word drug. But are there good drugs and bad drugs? That's a very good question. Let's look at the so-called good drugs used in medicine such as penicillin. Is it completely safe? No toxic or unwanted side effects? The answer is no. And no drug can fit in these criteria. While penicillin is considered one of the safest and most effective antibacterial agents ever discovered, it still has its own drawbacks. It has effect limited only to certain bacterial strains, and it's becoming less effective with growing bacterial resistance, and some individuals might even experience a severe allergic reaction to the compound. Let's take a different example of a bad drug. Heroin. It's highly addictive and surely it doesn't have any good points, right? Wrong. It's one of the best painkillers known to medicine. In fact, it was named heroin at the end of the 19th century because it was thought to be the heroic drug that would banish pain for good. But of course, later its addictive properties became evident and was withdrawn from general distribution. One definition could be to classify drugs as compounds which interact with a biological system to produce a biological response. It covers everything we mentioned so far, right? And even more. A cup of coffee, tea, and cocoa. All of these beverages contain the stimulant known as caffeine. Whenever you take a cup of coffee, you're a drug user. And whenever you crave a cup of coffee, you're a drug addict. Even children are affected by this with their soft drinks. Caffeine is a drug which, when you take, you experience a change of mood or feeling. Poisons can also fall under the same definition, though extreme, sometimes fatal effect. And how we can determine the toxicity or safety of a drug is by using the therapeutic index. It's the measure of the drug's beneficial effects at low dose versus its harmful effects at high dose. Simply, it's measuring the drug's dose level required to produce toxic effect in 50% of the patients to the dose level required to produce the maximum therapeutic effect in 50% of the patients. A high therapeutic index means drug has a large safety margin between beneficial and toxic doses, while a low therapeutic index means it's a tighter margin which you need to be very careful while administering those medication. Therapeutic index for penicillin is more than 100, quite safe, while for, let's say, alcohol, it's 10, which is more toxic. Generally, almost anything taken in excess will be toxic, whether it was 100 tablets of aspirin or even eating 9 kilograms of spinach at once. In conclusion, drugs can be viewed as actual or potential poisons, but a very important factor is selective toxicity. Many drugs are effective because they are toxic to problem cells, while not for normal cells, like antibacterials or antifungals. They are drugs useful in medicine because they are selectively toxic to microbial cells and not mammalian cells. Now, since we know what drugs are, we need to find out why, where, and how they act. And that will be our topic for the next video.